I'm Dr. Ashwani Sharma, Associate Director Surgical Oncology and Robotic Services, BLK-Max Cancer Center. Mrs. Nangsway, when she visited to us, she had a recurrent thyroid cancer. She was operated in her native country around 5 years back for thyroid cancer. Post-surgery, after 5 years, she had recurrence in the neck and the lungs. Thyroid cancers per se, they have got very good prognosis and a long survival. But recurrent thyroid cancers, these are difficult situations and should be managed at a specialized cancer center only.
ကျမပမာပြည်ရန်ကုန်မြို့ကနေပြီးတော့လေရင်နဲ့18ရက်နေ့အိန္ဒိယကိုရောက်ရှိပါတယ်19ရက်နေ့မှာ BLK ဆေးရုံကိုရောက်ရှိပါတယ်
So when she visited us, we did a comprehensive examination and gone through her medical records. She was found to have a metastatic disease. On evaluation, she was found to have disease in the neck and the lungs.
ဆေးရုံမှာစမ်းသပ်မှုပြုလုပ်ပြီးတဲ့နောက်မှာခွဲစိတ်ခဲ့ရပါတယ်ခွဲစိတ်မှုအောင်မြင်တဲ့အတွက်ကြောင့်မလို့ဒေါက်တာရှဝါရီကိုကျေးဇူးအထူးတင်ရှိပါတယ်
So we discussed the case in the tumor ward, which is what we do for most of the cases, and a treatment plan most appropriate for her was formulated. So we decided to do a surgical resection of the disease in the neck first. So we did a bilateral neck dissection and a central compartment clearance. Post-surgery, she recovered well and she was referred to the nuclear medicine department for second phase of her treatment.
Nuclear ကိုလွှဲပြောင်းပေးခဲ့ပါတယ် Nuclear ကိုရောက်ရှိတဲ့အခါမှာဒေါက်တာအယ်ကာရဲ့ကျေးဇူးကြောင့်မလို့ကောင်းမွန်စွာအောင်မြင်ခဲ့ပါတယ်
I'm Dr. Alka Kumar, Director of Nuclear Medicine. This is about a female patient who was referred from Myanmar for the diagnosis of thyroid cancer. She was operated at our hospital and post-surgery, she was referred to nuclear medicine for a I-131 whole body scan. And when we did the scan, we found some residual tissue in the neck and we also found bilateral lung metastasis. So we admitted her and gave her high-dose radioiodine therapy because that is the only treatment option available after surgery. So patient is doing well and she has to come for follow-up after every 6 months so that if any residual tissue still remains, we can retreat her with iodine therapy. This therapy is a targeted therapy which goes only to the cancerous tissue and does not have any systemic side effects like other chemotherapies, and therefore it is specifically used for thyroid cancer.
ဆေးရုံမှာအစကနေပြီးတော့အဆုံးအထိကူညီခဲ့တဲ့မဆိုးစန္ဒာကိုအထူးပဲကျေးဇူးတင်ရှိပါတယ်ဆရာဝန်ဆရာမများအားလုံးရဲ့စောင့်ရှောက်မှုကြောင့်အခုကျမအားကောင်းမွန်ပြီးဖြစ်ပါတယ်မဆိုးစန္ဒာရဲ့ assistant ဖြစ်တဲ့စုမိကိုလည်းအထူးပဲကျေးဇူးတင်ရှိပါတယ်ကျေးဇူးတင်ရှိထိုက်သူအားလုံးကိုကျေးဇူးတင်ရှိပါတယ်
We at BLK-Max provide a comprehensive oncology cancer care program comprising of surgical oncology, medical oncology and radiation oncology, and well supported by other ancillary departments including pathology, radiology and nuclear medicine.